Okay. Hello. Welcome to everybody who is going to be joining us on this edition of our Real Talk with One Elephant. We mentioned in the stories today that we are pumped about this topic. I think I love it. Digestion is such an interesting subject to talk about from each of the angles of all of our practitioners. So if we don't get through everything today, rest assured we will bring this up again in the future because April is sort of all about digestion, and we want to be able to support whoever is listening to this in your journey with, optimizing your digestion. And we're just going to dive right in. So we did get a couple of questions actually from the story this morning, which is great. And we'll try to kind of bring them up throughout the conversation today. But I just want to sort of start with getting a sense of, maybe I'll start with you, Dr. Lewis, because I know you are a fellow digestion lover. Tell me a little bit about how you manage or support your patients with digestive concerns, and maybe even starting with what types of symptoms you tend to see the most when someone walks into your office with gut issues.
Yeah, that's such a great question, Noreen. And I don't think the group of us have smiled as much, maybe because we're also wearing a lot of yellow today, but I think it's because of the topic of everything related to poop. We treat a lot of digestion in my naturopathic practice, Noreen in your dietetics practice, and throughout our clinic, really. But sometimes we don't necessarily know what all falls under the umbrella of digestive function. So let's definitely start with that. When we're talking about digestion, we're not just talking about bowel movements, although that is the first place that people generally will think about. Mm-hmm. We're also talking about anything from low appetite or impaired appetite to bloating, gassiness, abdominal discomfort, either around eating or when you're hungry and you haven't eaten, or reflux. Like we've got some patients who experience heartburn or too much burping. Like all of those things can really fall under the umbrella of digestive function. But it just goes to show you the breadth of what our digestive tract really entails. It starts off in the mouth. So as soon as you are even thinking about food, your mouth is going to start the digestive process by starting to secrete saliva in anticipation of food. And this is something that can happen even if we're watching someone cook on TV, or we're not actually in the arena where food is being prepared. We're still going to start to get excited about anticipating food, and you probably are going to notice that your stomach starts churning when you're kind of scrolling Instagram and you find something that looks, really appealing to you. So there doesn't need to be that direct physical contact with food for us to start engaging in the digestive process. And then it kind of goes down from there. So it starts off in the mouth, down the esophagus, and then the first stop where food goes into is the stomach. So that's part of the digestive process. And then we've got this complicated back end, which is really important in absorbing our food and ensuring that we're getting all of the nutrients from our food. So systems like the pancreas, the liver, the small intestine, all happen before we get into the area of the digestive system, which is involved in bowel movements, in poop, right? And that's the large intestine. So we have this long tube starting from the mouth all the way down to the rectum, which is what digestive function really is involved with. And so because of that, we've got so many different connections, so many different ways that this might manifest when you've got digestive issues. And so it lends to a lot of interesting kind of presentations, and also very interesting ways that we can also treat it, which is cool.
Awesome. Well, thanks for that overview on digestion. It's crazy how many different symptoms there are that people will report when it comes to digestion, right? A lot of us think that digestion is just your simple constipation, diarrhea, but it's so much more than that, right? And that's actually great. So on our team, we right now have there's manual therapists on our team right now. And oftentimes people will not think of digestion from a manual therapy standpoint or from a neuromusculoskeletal standpoint. So Joe, knowing that this is some part of your practice, how often is digestion a complaint that some of your patients are coming in with, especially for pelvic floor physio?
I think that with digestion, sometimes it's something that they come in readily being like speaking about, but oftentimes it's something that we unearth through the assessments and through asking them questions about what the subjective symptoms are and what's going on. And with pelvic floor, we really do delve into bowel and bladder function. So we talk about urine output. We also talk about like poop as well, like how often, what's going on, how does it look like? And that really pays attention to like how your pelvic floor is working, but also how your core is working as well. So some people, they may experience like pain with like intercourse, or they may experience like pain within their low back. And it could be a facet of the fact that they may be constipated and the digestive system isn't working as well as it ought to. So the pelvic floor and digestion and the rectum and the bladder, they're so connected and they're so connected. So like where it rests, if your pelvic floor is tight or if it's not functioning as well as it ought to be, that can actually feed into what's going on within your bowel movements. On the other end, let's say you are experiencing constipation or bowel dysfunction, that could actually affect what's going on within your pelvic floor. Okay. So we really want to make sure that those two systems are really well aligned. And then that also ties into what's going on within your diaphragm as well. So your diaphragm is a muscle. So that encircles throughout your entire abdomen round. So your diaphragm and your pelvic floor, they work together as pistons. So let's say we're taking a look over here. So let's say the blue one is your diaphragm and the beige one is your pelvic floor. So when you inhale, your diaphragm comes down and your pelvic floor also descends in order to accommodate the air that's coming in. When you exhale, the diaphragm relaxes and the pelvic floor contracts and comes up. So it moves together in synergy. So the reason why the diaphragm is so important is that as you're able to breathe in, you actually allow the abdominal muscles and the internal muscles to be massaged slightly. Okay. So if you're not getting a good breath in, this means that your organs and your intestines aren't able to have the mobility or the motility that's needed in order to break down food and to allow with the digestive process.
Mm-hmm. That's so interesting. I think, sorry to butt in, just I'm so excited. I just can't handle it. I think that this is exactly why, Joe, what you're talking about, this is why having a team like the one that we have at One Elephant is just so necessary, I think, with this topic in particular, because, you know, as a dietitian, there's so much I can do in terms of, you know, diving into what are you eating? What are the symptoms? What are the triggers? What are you not absorbing because of your digestive, the integrity of your gut? You can get into all of this, but there is this piece of the puzzle that we can't get into. It's beyond our scope. And it's something even the patient may not actually understand in terms of everything that you just discussed and like described so well. We just think about what I'm eating is bothering my stomach. And that's really, that's what we think. But then when you look at the mechanism and the way your body is actually allowing for all of this to come together, it's being able to target that specific area through manual therapy is just such a great missing link that I think we can add to our mix of treatment at the clinic. So I love it. I love it. That's all I have to say.
It's a good point, right? Like we all forget that our internal organs are all muscles themselves too, right? So you have to work them in a way to get them working most optimally. And for us, it is through that breath to start getting the stuff to be moving from an internal standpoint, right?
Yeah.
Robin, what about you? Like it's tough, right? Because like I will oftentimes talk to patients about digestion, but in my practice, it's more so about, okay, what's your digestion like? Oh, okay, I think you need to go see the rest of our team, right? So how are you finding, like helping individuals with digestion in your own practice?
Yeah, I've been lucky as far as the patients I've seen through One Elephant, even when we were at our previous clinic together, that a lot of the people who came to me with digestive concerns, you know, whether they were diagnosed with IBS or Crohn's or any number of inflammatory bowel disorders or inflammatory conditions, I was lucky enough that they had already seen who I would refer them to anyway, and I was just complementing that treatment plan. There have been a few, though, that I've seen that, you know, it has been that situation where I've asked those questions. I've talked about how a lot of times when people have low back pain, it can have nothing to do with, not necessarily nothing to do, but it might not be a musculoskeletal issue. It could be a bowel issue. If they're really backed up, if there's a lot of inflammation, that pain could be coming from somewhere else. And we've talked to them about that. One of the best examples I can give of sort of how I implement my skill set into like manual therapy into helping digestive concerns, whether it be just causing discomfort or other imbalances or inflammation, pain in general, is a lot of movement in treatment. I don't do as much passive work when it's incorporating that many pieces in the system. So, you know, when I used to work with infants in one of my internships in college, it was as simple as, you know, if the infant had colic or was constipated or had gas or, you know, had issues with keeping their food down, stuff like this, we did a number of gentle, like more superficial techniques over the abdomen. You would pump the legs, trying to get things moving. You know, adding to what Joe was saying, when you have those muscle imbalances in those core intricate muscles around those structures in the bowels, you getting things moving around the area, getting the whole fascial chain more fluid and getting things circulating can help. So when in treatment, typically what I'll do is I'll do a lot of passive stretches. I'll bring the legs up, I'll bring them back down, and I'll kind of repeat that over and over again with some breathing techniques, engaging the diaphragm, and more superficial techniques just to kind of get the lymph going, the blood circulation going, as well as to redistribute any pressure as far as gas goes and things like that. But it is tricky. Definitely, a lot of the times I agree. You kind of refer out to people who have a little more expertise with that. Yeah.
Yeah, it's just such a multifaceted condition, right? It's interesting because I've always thought of digestion as being really up the alley for psychotherapy, for dietitian, for naturopath. I haven't really seen the need for manual therapy in it, but the more and more that we're delving into this topic, I'm like, oh no, there actually is like a huge component of a manual therapy standpoint, right? So thanks for bringing that, you know, to the forefront of my mind, and I'm sure a lot of the people that are viewing this as well. So I guess one of the topics I wanted to talk about was mindful eating, because you hear that being thrown around so much, right? And, you know, a lot of people probably think that their digestion is 100% linked to just what they're eating, Noreen, like you mentioned. So what is mindful eating? Does it have its place in digestion? What are your thoughts on that? And I know that between you and Sim, this is going to be a great topic to talk about.
Yeah, I again, just one of the reasons I love having Sim and Crystal just, you know, an office away in this type of scenario, because digestion is definitely one of the main concerns that people come to me for. And mindful eating is something that I will usually look at in terms of just behavior around eating. So before we get to mindful eating being what we're going to work on, we really get deep into, okay, now we know what you eat, let's talk about how you eat, and get a better idea of as simple as, do you eat really fast? And that's really cutting into the process of digestion and making you feel bloated and gassy, because like Dr. Lewis said, you're not allowing digestion to start where it's meant to start, in the mouth. And when we get a better understanding of the behavior around a meal or an entire day of eating, then we're able to kind of begin that process of understanding, okay, these are the things I need to really be present for and aware of in the meal that I'm consuming. And that's where mindful eating comes into play. A lot of people think that mindful eating is about, the actual practice of, putting the raisin in your mouth, and first you're looking at it and then you're smelling it, and then that practice is very valuable, I think, because it brings you back to this process of being very present. But at least the way that I incorporate it is we use actual meals and snacks that someone is already eating in their day to slow it all down and just take away any of the distractions and be there and enjoy that food. And I even use it in a way of like emotional eating. Like there's guilt and stuff associated with eating. If you can very mindfully eat a food that you are very aware isn't really going to serve you in any way but make me feel good because it was tasty, right?
You mean a bowl of ice cream?
Like a bowl of ice cream, like 5 slices of pizza, whatever it is. But that's kind of how I will introduce the idea of mindful eating. And then because of that whole gut-brain connection and knowing that stress, anxiety, worry, all of the emotional aspects of digestion, there's a reason why people with Crohn's disease and colitis and an irritable bowel or inflammation will flare up in moments of stress. We know that. So there is a major connection, and it's great that research is going in that direction, and we're really diving deep into that gut-brain axis. But for me to go there, I feel like I have someone like Sim or Crystal to refer out to really get into the emotional aspects of eating and any emotional issues or traumas or anything that we know are going to be linked to this relationship with food, and see if by managing stress and really understanding your emotions and what you're dealing with on an emotional level, can that somehow play a part in improving your digestive health?
Awesome. Sam, what do you think about that? So I'm sure in your practice you see a ton of people, and it may not be for digestion itself, right? People may be coming to see you for weight loss, or their motivation and their struggle when it comes to weight loss. I think one of our questions from our IG response today was asking about, some of the changes with body weight and changes when it comes to IBS. So what do you think in your practice when it comes to all of that?
So I see a lot more, like you said, more people come to me for the weight loss or relationship with the food, not as much about digestion unless it's been referred in. And again, I would want to then look back to Noreen as well to kind of help understand that. How should I be informed as a practitioner so that I'm saying the right things to the client? But generally, it's more people who are looking for other things, and then we get to the root that there are digestive issues, and I think that we don't always appreciate that chronic stress has such an impact on our neurological functioning as well as the rest of the body. And so we make different types of decisions under stress. And it's helping people understand that when our perception of stress increases, because a lot of this has to do with our perception. And I think that's where psychology comes in as well, is to help people identify that what might be stressful for me and lead to certain types of food choices is not going to be the same trigger for somebody else. So for example, if I'm really upset, I am not someone who wants to eat. Food turns me off. But if I'm in a good mood, or if I'm just in a relaxed, neutral mood, you can bet that I am eating every chance that I can get. Like, I just love it. Like, I just want to eat. And so I think connecting people with emotional triggers and how they impact our ability to actually eat from a psychological standpoint is really helpful with understanding why the stomach clenches when all of a sudden they're stressed, and then why sometimes going and adding carbs is better for you in the short term because it leads to some sort of relief, behaviorally speaking. And then we deal with the effects of it much later. So it's almost like that marshmallow story, the delayed effect, right? So because the effect of eating poorly is a little bit delayed, we don't always necessarily appreciate that our choices are creating that a picture for us too.
Yeah, it's a great point. Like we've been talking with everything that's going on with COVID, how many of us are grazing or snacking or eating a lot more. And yeah, I'm sure there's a component of routine and sticking to your guns and you know, that kind of stuff. But there is a component of this stress, right? Like some of us are, whether or not we're openly admitting that we're stressed out about what's going on, we could be potentially overeating or undereating in that regard, right? Like all of us are different in our own regards. So I think that all brings up a very it brings up so many different points to the fact that digestion itself is so multifaceted, right? And it's just not a one-stop shop, and you can't just fix your eating or work out a little bit more or fix what's going on in your mind to help with what's going on with digestion. It is a very complicated system that has many different arms to it. So yeah, that's
I think to add to the
oh, go ahead.
just to add to the weight loss piece, because I know that was one of the questions. I think it's also worth noting that you know, as complicated as digestion is, it's often important to look at, you know, okay, I'm not losing weight. Could this be related to my gut, right? And that can be so many different scenarios playing out because of the way that all of our systems are like how they react, how they respond to one another. So, you know, there could be something underlying that's impacting your gut, which is impacting your ability to lose weight. And so having the patience, in a sense, to kind of put this story together with somebody is so important. And I think that's where, for me to be, you know, somebody that's worked in a hospital and now more on the holistic side of things, I think is so valuable to have a team to actually take the time to go into these issues, because IBS is really, I mean, sometimes it's just an answer to something more complicated is going on, and I don't know what it is, right? That's usually what you'll get from maybe a doctor who's unsure. And then the patient comes in with, I've been told I have IBS, right? And then it's, you know, take a line or take a probiotic and we'll see what happens. When really, if we're taking the time to actually understand why you walked into the doctor's office in the first place, and that starts from childhood sometimes, you know, if you can start from backwards. And I think that's maybe where I really like to co-manage my patients with you, Dr. Lewis, because between the two of us, we can actually go back and kind of put the pieces together and then build out this plan with nutrition, natural health products, and just, again, the manual side of things with our manual therapist, and then the psychological. So you can put it all together if you know the whole story. And then that also gives the patient this peace of mind of, okay, this isn't just me eating wrong and I'm not seeing the physical side. There's more to this than I thought.
I think that's so well said, Noreen, because I think it also shows the importance of why we have the model that we have and why we work the way that we work. And you refer to each other within our practice is because we are putting the pieces together and we are trying to figure out the layers to who we are as individuals, not just sort of pigeonholing the issue itself.
Oftentimes, sorry to jump in there, Dr. Yod, what Noreen was saying, I could not agree more with. Sometimes what happens with digestion is it shows up as a physical symptom when it's really, as you described, a much deeper issue. And I almost look at it as if you were driving a car. And when you're driving a car, you know, your check engine light comes on. And your check engine light in this case is just telling you, hey, look under the hood. There's something going on here. And oftentimes, so often, we find that digestive symptoms are that check engine light. So it'll show up as bloating, gassiness, constipation, loose stool. And unfortunately, sometimes we're too quick to diagnose this problem as irritable bowel syndrome. And we're in IBS month in April. So we're talking and focusing a little bit more on that condition for this reason. And oftentimes we put this label on it when when unfortunately we're doing a disservice to the patient to say, hey, this is what your problem, the problem is digestive, when really when we kind of go through the layers of the onion and we determine that actually it's anxiety, right? Actually underneath all of it, there's a very clear gut-brain connection. There's a very clear psychological, mental, emotional root, which is where sometimes patients will come to see you or Crystal Sim, so our psychotherapists on our team, and they're presenting with digestive system symptoms as well as psychological symptoms like anxiety, stress, overwhelm. And they're looking maybe at the problem as two disparate issues when really their benefit sometimes when we do nothing interventionally for digestion specifically, like we haven't put them on, any changes to their diet, we haven't put them on probiotics or digestive enzymes or any of these other tools that we have, and they're seeing you and seeing benefit to cope with their stress, cope with their anxiety, then they come back to us and they say, actually, hey, a lot of my digestive symptoms have improved. And that's the beauty of this holistic collaborative approach, right? We get to teach patients and empower them that they actually have the tools within them. They have the tools within the way that they think, the way that they handle stress, the way that they process their environment. And yes, we may coax their body from a very physical level in terms of managing digestion, but really what we're getting at is such a beautiful thing because we're getting to the root. We're getting to the root cause. We're getting to the core layer of the onion. And that is what gives us the long-lasting, sustainable change then, right? It's such a beautiful thing. That's why we're all so excited to talk about it today, because there are so many ways to look at the problem. And it's so encouraging for patients and for ourselves when we can see true transformation and true changes that are long lasting to their health. It's really cool.
Yeah, it's a great point. I was going to actually ask you, Dr. Lewis, to talk a little bit more about, it's a great point that you just segued into the check engine light, because I find with digestion, it's almost like the sleep, right? Like when you lack sleep, you see so many deficits in different areas of our lives, right? But I think the truth can be said about digestion, right? Like people that are not not eating well or having poor digestion are likely to have low energy because of malabsorption or whatever else may be going on. So I'm sure you've seen deficits in other areas that clear up. Can you talk a little bit about that?
Yeah, that's such a great question. And I feel like we're going to probably have to do another IG Live to talk about all of these other areas. But just briefly, let's get into that for sure. When we're looking at our health, I generally will look at health as a pyramid, right? And so at the base of that pyramid, foundational systems exist. One of the foundational systems is digestion, for sure, bar none, no question. And I don't think many people are going to argue with that. And the reason for that is this conversation, because everything builds from digestion. If you don't have that foundational area intact, optimized, and working well, then you're behind you've got an obstacle that's so difficult to overcome when it comes to absorbing the nutrients properly from your system in order for you to have the right nutrients to get ahead in terms of energy, like you mentioned, but also in terms of things like hormonal health. A lot of our hormones are synthesized and made in the gut. They're made in the digestive system. Also in terms of depression and anxiety, like a lot of these neurotransmitters are metabolized and synthesized in the gut. Again, that gut-brain connection. When we talk about pain, inflammation, headaches, the list, immune health, how timely is that conversation with what we're going through right now? All of these areas are really built from a strong foundation with gut health. So sometimes what happens is a patient comes in and they say, I want to lose weight. I've got inflammatory issues like arthritis. I've got sleep issues. I've got poor energy. But if they at all flag with a lot of these different symptoms that we've talked about when it comes to digestion, guess what? We're tabling everything else and we're starting here. Because if we don't fix it, then, what are we're really treating things from a symptom and Band-Aid approach. And that's not the type of medicine that we like to practice in our clinic. We really like to get to the root, and we want to be smart with how we handle our patients and their health, right? So anyway, we could go on and on with this one, but I'll stop it there.
No, we're also getting so many comments, on the live, and just so everybody knows before we end, we're going to review all of these and probably address them all in the next live so that we're not rushing any of the answers. But we really appreciate everybody joining in and kind of being a part of this conversation. Clearly, we can all communicate about poop. It's like the best topic ever.
Let's just destigmatize it. Let's just destigmatize it already.
My favorite topic. We all know that.
There's one more thing I could add that I thought was kind of interesting that I noticed over the time that I've been treating a number of people with postural issues. What's really interesting that I've noticed, and I'm sure some of you have noticed as well, being women, I think that I noticed that with women, their posture is often more rounded forward and sort of covering in both their chest area and abdomen. And I found that as sort of an additional treatment, that's separate from what they think they need, what they think they need, and I need to work on their neck and shoulders, for example, because their shoulders are so rounded. And if all your tackling is right in the area, it's not going to give you best results. Like you said, the root of the problem. And I've sort of found out by trial and error that incorporating things like abdominal massage, or even more like hip massage, I'll be working on that area, and they'll be thinking to themselves like, this is weird. Why is she working down there? Like, my issues are up here. And without them even realizing this, their shoulders will start to relax because they're guarding so much. So I just found that, I don't know if Sam, you have anything to add with regards to like psychology more specific to women and how that sort of guarding behavior really contributes to that posture and that anxious sort of protective reflex. But that's just
so we'll hold that thought because we have so much. I hope someone's taking notes about the stuff that we need to cover on our next topic. But just to summarize our topic today, it was so many tidbits and little nuggets that came out. But my summary from this is that digestion is a multifaceted condition. So many different parts of our system, like sleep, energy, weight loss, physical health, are impacted by our digestion. And so eloquently put by Dr. Lewis, the digestion is our foundation almost, right? That we have to always come back to. And I've never, ever thought of it from that angle. Second tidbit is not to watch a ton of cooking shows during COVID right now, because that definitely is starting the digestion. I'm always like salivating when I'm seeing some of these cooking shows. And the last tidbit is that we're not rushing and eating our breakfast and running out the door as so many of us are doing, right? And we're not really sitting there and taking in what we're eating, why are we eating it, what's the purpose of it, to help our digestion. So this was fantastic. Good conversation, guys. And we'll catch up on the next one, and we'll dive in a little bit more about some of these topics and answer all the questions that we got on IG.
Yeah.
Yay.
Bye, guys.
Okay. Bye, guys.
Yeah.
See ya.